There are two East Yorkshire men. One is fighting testicular cancer. The other suffers from a brain degenerative disorder. Now, fighting their illnesses has become one battle, but now they're about to fight another. Cuts to the local NHS. It's been reported in the local press that leading health professionals are worried about ward closures at Hull Infirmary and Castle Hill Hospital in Cottingham. Now, Dermot, Rathbone and Marten are holding a rally on Saturday in Hull's Queen Victoria Square against these cuts. And Dermot and Danny are both with me in the studio. Morning, fellas. Thanks for coming in.
Morning, Andy.
First, if you could just in turn just tell us about your illnesses, please.
Well, I was diagnosed with testicular cancer 10 weeks ago, and since that time I've had an operation and I've started undergoing 3 courses of chemotherapy.
I was diagnosed with a degenerative brain condition in 2004. I was on Ward 12 in Hull Royal, where I underwent extensive diagnostic testing by the neurological team, but it appears now that these specialist beds are no longer going to be available in the trust. They were able to pinpoint what was wrong with me and then send me to the appropriate specialists in London. So it's a genuine worry for patients and for consultants that these avenues will no longer be there.
I wouldn't normally pinpoint people's ages. I think it's worth saying. I mean, you're both young guys, 25 and 45, if you don't mind me saying. What about your treatment? How's your treatment been?
Treatments for my uncle with the BEP chemotherapy, which I'm receiving at Castle Hill, which of course is a first-class unit. Treatment's rough, but it's life-saving treatment. I think it is worth saying that we probably would have run this campaign anyway, but it seems a lot more poignant now more than ever, because you don't realise how important the NHS is until you actually are depending on it for life-saving treatment.
Absolutely. I've received treatment at Hull Royal on a regular basis and at Castle Hill. The staff are just excellent. I mean, they treat you like you're a member of their own family. They're just amazing. And these people have trained for years and years and years. And the last thing they want to do is get involved in politics. And that's the thing that strikes me more than anything, is that 17 cardiologists feel so strongly regarding this situation, and 7 neurologists at Hull Royal that I've come in contact with, that they feel so strongly that they've had to engage with politicians. Politicians can argue all they want about allocation of resources, but this comes down to human consequences, and this is unprecedented.
I mean, you've obviously done your homework and you know what you're talking about on this, and you've looked into it. How did this come about then? How did you get involved in this, what is now a campaign?
Well, basically, from our point of view, we're both political activists with the Labour Party, but to me this transcends party politics. I mean, David Davis is concerned about this, and I know that a number of other local MPs as well, Andrew Percy, etc. There is an enormous well of goodwill surrounding the NHS from all political parties. And I would say to Phil Morley, engage with local politicians from all the parties. There's so much expertise out there. If Phil Morley can reach out, he's the head of the PCT, if he can reach out to these people and draw on the enormous well of experience that they've got and the goodwill of the community towards the NHS.
You mentioned Phil Morley, their chief executive of the NHS Trust. I mean, Danny, have you had any contact with the NHS at that sort of level?
Have you had contact with the NHS, Dermot?
Well, basically, what we've looked at, and Carl Turner, who's the local MP, Phil Morley, there's been a statement from the Trust saying that they've wanted to engage with the health professionals, but there seems to be some kind of smoke and mirrors thing going on here. We'd like Phil Morley to give us a bit of clarity. If he feels that he can implement a programme which doesn't impact on patient care directly and does help him make these efficiency savings, then we'd love to hear from him about that. But it's got to a stage, it seems to me, where the health professionals are so disengaged from the management that there seems to be a big impasse, and through the rally we would like to try and break that impasse and to get a situation where there's dialogue between patients, between the health professionals and the trust.
I mean, you can't underestimate the size of these cuts. You're going from 1,500 beds to 1,200 beds. you've got to consider the knock-on impact in the winter months to elderly relatives. If you're considering that hospitals like Castle Hill that do cope currently, the strain, the knock-ons to other services, social services and healthcare like that as well. You're looking at these black and red alerts that are published every winter. Can you imagine the knock-on care? It's fine, if you're undergoing, long-term treatment, but what if you have an elderly relative that's ill? We have to remember how the NHS was formed and that it is funded for by the taxpayer and that therefore it belongs to us, and when we're not happy about these cuts, we know which are coming and we have to face them, but we're not happy about them, so ordinary people like us do actually have to stand up and say, no, we're not happy with this.
You've mentioned the rally. Just tell us about the rally then, where and when it's going to be.
We're going to be rallying at midday in Victoria Square. Well, there'll be a variety of speakers, including Carl Turner, including health professionals and patients. And the aim of the rally is to galvanise public opinion, to try and pile some pressure on the relevant people to get round the table and sort this out. We are looking at £27 million so-called efficiency savings, 90 million over the course of this Parliament. Now, if you look at the figures in terms of things like tax avoidance, we're looking at £120 billion in tax avoidance. This was mentioned in the House last night by Kelvin Hopkins, one of the MPs. So we're looking at the Tories are saying they want to cut 20 billion in efficiency savings. If you look at that in terms of unpaid tax, and I know people bang on about the banking culture, but we are where we are because of what happened with the banks. So there has to be some kind of social responsibility from people involved in that industry, because this is impacting directly upon there are human consequences now for what happened.
It's really important actually that we actually ask people to attend this rally and sign our petition. We've actually set up a Facebook group. If you search for Save Our Local NHS Rally, and if you could invite people, and the more people we get there, the more credibility obviously this will have. If ordinary people stand up against these cuts, then maybe we may get the opportunity of a U-turn. We've got to protect this service, not just for now, but for our children and obviously for their children. Once you take it away, you might never get it back.
Exactly, and also you can have the Labour leader, Ed Miliband, all these people doing rallies, but this is about people power. This is about the ordinary people in the community coming out to support us right across the spectrum. If David Davis, Greg Knight, Andrew Percy want to come and give us their support, they're more than welcome to come and share the platform with us. We take support wherever we can find it. I want to praise also Katie Wood at the Hull Daily Mail for shining a light into this very sort of dark chasm. The journalists, it's a very important job that they do, and so a lot of praise to local media and to yourselves for highlighting this issue.
Right, it's midday, Queen Victoria Square in the centre of Hull on Saturday. All right.
That's right.
Thank you both for coming in. Thank you. Thanks for the time.